Before I die, you need to know this. If you are over 60, there is a very high chance that your body is not absorbing vitamin B12 properly, even if you are taking supplements every single day. This is not your fault, but ignoring it can lead to serious nerve damage, memory problems, and irreversible health decline. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. As a doctor, I have seen countless seniors who come to me complaining about fatigue, numbness in their hands and feet, difficulty concentrating, and unexplained mood changes. Many of them assume it is just part of aging. But when I test their vitamin B12 levels, the results often reveal a severe deficiency. The shocking part is that many of these patients have been taking B12 supplements for years. So what is going wrong? The problem is not that you are not taking vitamin B12. The problem is how you are taking it, and more importantly, whether your body can actually absorb it. After the age of 60, your stomach produces less stomach acid. This acid is absolutely essential for breaking down the protein-bound B12 found in food. Without enough stomach acid, your body cannot release B12 from the food you eat, and it passes right through your digestive system without being absorbed. This is called atrophic gastritis, and it affects up to 30% of people over the age of 50. It gets worse as you age. By the time you reach 70 or 80, your stomach lining becomes even thinner, and your ability to produce intrinsic factor, a protein needed to absorb B12, drops significantly. Without intrinsic factor, even if you consume large amounts of B12 through food or standard oral supplements, your intestines cannot absorb it efficiently. Now, let me explain why this matters so much. Vitamin B12 is not just another vitamin. It is critical for the production of red blood cells, the maintenance of your nervous system, and the synthesis of DNA in every cell of your body. When your B12 levels drop, your nerves begin to deteriorate. You may start feeling tingling or numbness in your fingers and toes. You may notice that you are becoming more forgetful, confused, or irritable. These are not just signs of old age. These are signs of nerve damage caused by B12 deficiency, and if left untreated, this damage can become permanent. Many seniors also experience something called megaloblastic anemia due to B12 deficiency. This means your bone marrow starts producing abnormally large and immature red blood cells that cannot carry oxygen effectively. You feel exhausted all the time, even after a full night of sleep. Your skin may look pale. You may feel short of breath even when doing simple tasks like walking to the mailbox. This is your body crying out for B12. But because the deficiency develops slowly over months or even years, it often goes unnoticed until the damage is done. Here is where the biggest mistake happens. Most people, and even some doctors, think that taking a standard oral B12 supplement is enough. They assume that if you swallow a pill, your body will absorb it. But this is not how it works for seniors. If your stomach cannot produce enough acid or intrinsic factor, swallowing a regular B12 tablet is almost useless. The B12 in that pill requires your stomach to break it down and your intestines to absorb it using intrinsic factor. If that mechanism is broken, the pill does nothing. So what is the right way to take vitamin B12 if you are over 60? The answer depends on the form of B12 you are using. There are several types of B12, and not all of them are absorbed the same way. The most common form found in cheap supplements is cyanocobalamin. This is a synthetic form of B12 that your body has to convert into an active form before it can be used. For younger people with healthy digestion, this is usually fine. But for seniors with absorption issues, cyanocobalamin is not the best choice. The better option is methylcobalamin or adenosylcobalamin. These are the active forms of B12 that your body can use immediately without needing to convert them. Methylcobalamin is especially important for nerve health and brain function. If you are taking a B12 supplement, check the label. If it says cyanocobalamin, consider switching to methylcobalamin. It is more expensive, but it is far more effective for people with absorption problems. But even methylcobalamin in pill form may not be enough if your stomach cannot absorb it. This is why sublingual B12 is often recommended for seniors. Sublingual means under the tongue. When you place a B12 tablet or liquid under your tongue and let it dissolve, the B12 is absorbed directly into your bloodstream through the mucous membranes in your mouth. This completely bypasses your stomach and intestines, so it does not matter if your stomach acid or intrinsic factor is low. The B12 gets into your blood regardless. Another highly effective method is B12 injections. If your deficiency is severe, or if you have been diagnosed with pernicious anemia, which is an autoimmune condition that destroys the cells that produce intrinsic factor, then oral supplements will not work at all. In these cases, B12 injections are the only reliable solution. The injection delivers B12 directly into your muscle, where it is absorbed into your bloodstream without needing any digestive process. Many seniors who receive B12 injections report feeling significantly better within days. Their energy returns, their brain fog clears, and their nerve symptoms begin to improve. Some people also use B12 nasal sprays or gels. These work similarly to sublingual forms by allowing B12 to be absorbed through the nasal passages directly into the bloodstream. They are convenient and effective, but they are not as commonly available as sublingual tablets or injections. Now, how much B12 do you actually need? The recommended daily intake for adults is 2.4 micrograms. But for seniors, especially those with absorption issues, this amount is often not enough. Many doctors recommend seniors take between 500 to 1,000 micrograms per day, especially if they are using sublingual or oral forms. This may sound like a lot, but vitamin B12 is water-soluble, which means your body will excrete any excess through urine. There is no risk of toxicity from taking high doses of B12. In fact, higher doses are often necessary to compensate for poor absorption. Here is another critical point. Certain medications can interfere with B12 absorption. If you are taking metformin for diabetes, proton pump inhibitors for acid reflux, or H2 blockers for heartburn, you are at a much higher risk of B12 deficiency. Metformin reduces B12 absorption in the intestines. Proton pump inhibitors and H2 blockers reduce stomach acid, which is needed to release B12 from food. If you are on any of these medications long-term, you must monitor your B12 levels regularly and consider supplementation. Vegetarians and vegans are also at high risk of B12 deficiency because B12 is found naturally only in animal products like meat, fish, eggs, and dairy. If you follow a plant-based diet, you must take a B12 supplement. There is no way around it. Plant foods do not contain bioavailable B12, and nutritional yeast or fortified foods alone are usually not enough to maintain adequate levels, especially as you age. Let me also address a common myth. Some people think that eating more B12-rich foods like liver, salmon, or eggs will solve the problem. While these foods are excellent sources of B12 for younger people with healthy digestion, they do not help seniors with absorption issues. Remember, the B12 in food is bound to protein, and your stomach needs acid to release it. If your stomach cannot do that, eating more B12-rich foods will not make a difference. You need a form of B12 that does not rely on your digestive system to be absorbed. So how do you know if you are deficient? The symptoms of B12 deficiency can be vague and easily mistaken for other conditions. Early signs include fatigue, weakness, and lightheadedness. As the deficiency worsens, you may experience nerve problems like tingling, numbness, difficulty walking, or balance issues. Cognitive symptoms include memory loss, confusion, difficulty concentrating, and even depression. Some people develop a sore or swollen tongue, mouth ulcers, or vision problems. In severe cases, B12 deficiency can cause irreversible nerve damage and cognitive decline that mimics dementia. If you suspect you are deficient, ask your doctor for a blood test. The standard test measures serum B12 levels, but this test is not always accurate because it can show normal levels even when your cells are deficient. A more reliable test is the methylmalonic acid test or homocysteine test. When your body lacks B12, levels of these substances rise. If your MMA or homocysteine levels are high, it indicates a true B12 deficiency, even if your serum B12 looks normal. If you are diagnosed with a deficiency, treatment usually starts with high-dose B12 supplementation or injections. Your doctor may prescribe weekly or monthly injections until your levels normalize, and then switch you to a maintenance dose. For people with pernicious anemia, lifelong B12 injections are often necessary because their bodies will never be able to absorb B12 from food or oral supplements. But prevention is always better than treatment. If you are over 60, I strongly recommend that you start taking a high-quality sublingual methylcobalamin supplement, even if you do not have symptoms. Do not wait until you develop nerve damage or anemia. By that time, some of the damage may already be irreversible. Taking B12 proactively is one of the simplest and most effective things you can do to protect your brain, nerves, and overall health as you age. Also, make sure you are getting your B12 levels checked at least once a year during your routine health checkups. This is especially important if you are on medications that affect absorption, if you have digestive disorders like Crohn's disease or celiac disease, or if you have had stomach surgery. These conditions significantly increase your risk of deficiency, and early detection can prevent serious complications. Another thing to keep in mind is that B12 deficiency is often misdiagnosed or overlooked. Many doctors do not think to test for it, especially in older adults, because the symptoms overlap with so many other conditions. Fatigue could be blamed on anemia from other causes. Memory problems might be attributed to normal aging or early dementia. Nerve issues could be dismissed as diabetic neuropathy. But without checking B12 levels, the real cause goes untreated and the patient continues to suffer. I have had patients in their 70s and 80s who were told they had early Alzheimer's disease, only to discover that their cognitive decline was actually due to severe B12 deficiency. After starting B12 injections, their memory improved, their confusion cleared, and they returned to their normal selves. This is why awareness is so important. B12 deficiency is preventable, treatable, and reversible if caught early, but it requires vigilance and the right approach. Let me also mention that B12 works closely with other B vitamins, especially folate and B6. These vitamins work together to regulate homocysteine levels and support nerve function. If you are supplementing with B12, it is often a good idea to take a high-quality B-complex supplement that includes all the B vitamins in their active forms. This ensures that your body has everything it needs for optimal nerve and brain health. One more important point I want to make is about the relationship between B12 deficiency and mental health. Many seniors experience depression, anxiety, and mood swings that are directly linked to low B12 levels. This happens because B12 is essential for the production of neurotransmitters like serotonin and dopamine, which regulate mood. When your B12 is low, your brain cannot produce enough of these chemicals, and you feel depressed or anxious even when there is no clear reason for it. I have seen patients whose depression completely resolved after correcting their B12 deficiency. This is why it is so important to rule out nutritional deficiencies before starting antidepressant medications, especially in older adults. Another overlooked consequence of B12 deficiency is its impact on bone health. Research shows that low B12 levels are associated with decreased bone density and an increased risk of fractures in older adults. This happens because B12 is involved in the activity of osteoblasts, the cells that build new bone. When B12 is low, bone formation slows down, and bones become weaker and more fragile. For seniors who are already at risk of osteoporosis, maintaining adequate B12 levels is crucial for preventing falls and fractures. Now let me talk about how B12 deficiency affects your heart health. When your B12 levels are low, homocysteine levels in your blood rise. High homocysteine is a known risk factor for heart disease, stroke, and blood clots. Homocysteine damages the lining of your arteries and promotes inflammation, which leads to atherosclerosis, the buildup of plaques in your arteries. By keeping your B12 levels optimal, you can help keep your homocysteine levels low and reduce your risk of cardiovascular problems. This is especially important for seniors who already have risk factors like high blood pressure, high cholesterol, or diabetes. I also want to address the issue of false reassurance from diet alone. Many seniors believe that because they eat meat, fish, or dairy regularly, they do not need to worry about B12. But as I explained earlier, eating B12-rich foods does not guarantee absorption. Your stomach has to be able to extract the B12 from those foods, and if your digestive system is compromised, you will still become deficient no matter how much meat or fish you eat. This is why supplementation is not optional for most seniors. It is a necessity. Some people worry about the quality of supplements and whether they are getting what they pay for. This is a valid concern. Not all B12 supplements are created equal. When choosing a supplement, look for products that have been tested by third-party organizations for purity and potency. Avoid supplements that contain unnecessary fillers, artificial colors, or additives. Choose brands that use methylcobalamin or adenosylcobalamin rather than cyanocobalamin. And if you are using sublingual tablets, make sure they dissolve completely under your tongue rather than being swallowed. The goal is to maximize absorption, and that means choosing the right product and using it correctly. Let me also address the timing of B12 supplementation. Some people wonder whether it is better to take B12 in the morning or at night, with food or on an empty stomach. The truth is that B12 can be taken at any time of day, and it does not need to be taken with food. In fact, taking it on an empty stomach may improve absorption slightly because there is no competition from other nutrients. However, if you are using sublingual B12, it does not matter because it bypasses your digestive system entirely. The most important thing is consistency. Take your B12 supplement at the same time every day so it becomes part of your routine and you do not forget. Another question I often get is whether you can get too much B12. The answer is no. As I mentioned earlier, B12 is water soluble, so any excess is excreted in your urine. There is no known upper limit for B12 intake, and there have been no reports of toxicity even at very high doses. This is why doctors feel comfortable prescribing high-dose B12 injections or recommending sublingual doses of 1,000 micrograms or more per day. Your body will take what it needs and get rid of the rest. Now I want to talk about a specific group of seniors who are at extremely high risk of B12 deficiency, and that is people who have had bariatric surgery or gastric bypass. These surgeries remove or bypass a large portion of the stomach, which is where intrinsic factor is produced. Without intrinsic factor, B12 absorption becomes almost impossible. People who have had these surgeries must take B12 injections or high-dose sublingual supplements for the rest of their lives. There is no alternative. If they do not, they will develop severe deficiency within a few years, and the consequences can be devastating. Similarly, people with autoimmune conditions like pernicious anemia or autoimmune gastritis are also at very high risk. In these conditions, the immune system attacks the cells in the stomach that produce intrinsic factor or stomach acid. This completely shuts down the ability to absorb B12 from food or oral supplements. These patients require lifelong B12 injections, and they need to be monitored closely to ensure their levels remain in the normal range. I also want to mention that B12 deficiency can sometimes present with unusual or unexpected symptoms that do not seem related to nutrition. For example, some people develop a condition called subacute combined degeneration of the spinal cord, which causes difficulty walking, loss of coordination, and spasticity. This happens because B12 is essential for maintaining the myelin sheath that protects nerve fibers in the spinal cord. When B12 is low, the myelin breaks down, and nerve signals cannot travel properly. This can be mistaken for multiple sclerosis or other neurological disorders, but it is actually caused by B12 deficiency and can be reversed with treatment if caught early. Another rare but serious complication of B12 deficiency is optic neuropathy, which causes vision loss. This happens when the optic nerve, which transmits visual information from the eye to the brain, becomes damaged due to lack of B12. Patients may notice blurred vision, difficulty seeing colors, or blind spots in their visual field. If treated promptly with B12 supplementation, vision can improve, but if the deficiency is left untreated for too long, the damage can be permanent. Let me also emphasize the importance of educating family members and caregivers about B12 deficiency. Many seniors live alone or rely on family members to help manage their medications and health. If a senior is showing signs of memory loss, confusion, or difficulty walking, family members should consider B12 deficiency as a possible cause and encourage the person to see a doctor for testing. Too often, these symptoms are dismissed as normal aging or dementia, and the opportunity for early intervention is lost. In summary, if you are over 60, do not assume that taking a standard B12 pill is enough. Your body may not be absorbing it. Switch to sublingual methylcobalamin, consider B12 injections if your levels are low, and get your B12 levels tested regularly. Pay attention to symptoms like fatigue, tingling, memory problems, and balance issues. Do not dismiss them as just part of aging. They could be warning signs of a deficiency that is damaging your nerves and brain right now. Taking vitamin B12 the right way can make a profound difference in your quality of life as you age. It can protect your brain, preserve your nerve function, keep your energy levels up, and help you stay independent and active for years to come. This is not optional. This is essential. Do not let a simple nutritional deficiency rob you of your health and vitality. So if you like this video, please like and subscribe for more videos like this.